A very good evening to all my fellow associates, guests, friends. Welcome to tonight's Zoom meeting. Now, we're back again after a short break, and I just want to thank you for your presence. I want to give a special recognition to all our guests joining us for the very first time, and also to our guests who are joining in with great expectation of how ASEA can help them health-wise and wealth-wise. I trust you will find tonight's session informative and beneficial to you. My name is Aaron Andy. I'm the healthcare consultant for the AACI, and I will be a moderator for tonight's Zoom meeting. And on page 239 of this book, Killing Cancer, Not People, you'll find ASEA redox signaling molecules mentioned, especially two very major words, glutathione as well as superoxide dismutase SOD is mentioned over there. Before we hand over this time to our speaker for tonight, let me introduce you to this video, an overview on the ASEA redox technology. Many of us have seen, and some of us has not, but it is certainly an excellent tool for introduction to our prospects and even to our associates. So can I invite Sansan to play the video now? Over to you, Sansan.
The human body is an extraordinary creation, made up of between 50 and 100 trillion cells, each one performing just the right function in just the right place at just the right time. Your cells themselves are amazing. Each one is a bustling metropolis of activity, a city that never sleeps. Every second of every day, your cells work tirelessly to keep your body healthy and strong. One of the major functions of your cells is the production of fuel. This fuel, known as ATP, is actually created by workers inside the cell called mitochondria. Mitochondria are so vital and important that a single cell can have thousands of these little workers. In fact, it is estimated that half of the dry weight of the human body is made up of mitochondria. Mitochondria do more than supply the body with the fuel it needs. They also play a key role in cell signaling and communication, coordinating the actions and activities of your cells. When you think about it, this kind of signaling is essential for health and life, since it is the foundation for things like cell development, tissue repair, and immune functions. Without the ability to communicate and coordinate the activities of cells, we would fall apart pretty quickly. The mitochondria's role in this vital communication system lies in the fact that they make special molecules, called redox signaling molecules. The mitochondria make these molecules by the trillions, every second of every day. Good thing, too, because without these redox signaling molecules, life itself would be impossible. You need these molecules to protect the health of your cells, to detect threats and damage, and to repair or replace injured cells. Unfortunately, as we get older, our ability to make redox signaling molecules diminishes. Ever notice that bumps and bruises that disappear in no time on a child seem to last forever on someone who is elderly? The cells in that older person simply aren't communicating as efficiently as they did when they were younger, and so cells and tissues take longer to repair themselves. And all because the body isn't making as many redox signaling molecules as it used to. But what if there were a way to replenish your supply of these amazing little molecules? What if there were, in essence, a redox signaling supplement? How would your life change if you had a supply of redox signaling molecules like you did when you were younger? Such a product would be incredible, but how would you go about making it? Well, a good start would be to understand how the mitochondria in your trillions of cells make these vitally important molecules. Your cells are little bags of salt water. The mitochondria and other organelles inside the cell float around in this salt water. It's not surprising, then, that when the mitochondria need building blocks for creating redox signaling molecules, they use something they have plenty of: salt water. It works out pretty great, because salt water is made up of just 4 atoms: the sodium and chloride atoms in salt and the hydrogen and oxygen atoms in water. The mitochondria pull apart these saltwater molecules, then recombine the atoms in different configurations. The new combinations are, guess what? Redox signaling molecules. Things happen so fast inside the cells that these redox signaling molecules are manufactured in just fractions of seconds. And they get used quickly too. And if the cells don't need the redox signaling molecules right away, the atoms convert back into salt water, ready to be used again and again by the mitochondria. It's a very efficient system. So to make a redox signaling supplement outside of living cells, it makes sense to start with the same building blocks, salt and water. That's just what a company called ASEA does. We begin with a pure, pristine saline solution. Then, using a highly protected and patented electrochemical process, we break apart the bonds that hold the sodium, chloride, hydrogen, and oxygen atoms together. These free-floating atoms are then recombined in new configurations, and voila! Redox signaling molecules. Of course, the process sounds a lot easier than it really is. Your mitochondria make redox signaling molecules in fractions of seconds. ASEA takes 3 full days to make the same molecules. But the real triumph for ASEA came in overcoming the issue of stability. Remember that redox signaling molecules made in the cell get used right away or else turn back into salt water? That's because redox signaling molecules are very reactive. They want to get busy and start working right now. This reactive nature makes it difficult to keep these molecules around for long. They want to get used or they'll revert back into salt water. Fortunately, after countless hours of research and experimentation, the scientists at ASEA reached a breakthrough. They discovered a process for pairing these highly reactive molecules into balanced sets, stabilizing redox signaling molecules outside of living cells. This really is something extraordinary. Molecules that last just microseconds inside the cell have a shelf life of over a year in a bottle of ASEA. Amazing! So what does ASEA, the world's first redox signaling supplement, mean for you? Simply put, it's an entirely new approach to health. Every other health and wellness product, vitamins, exotic juices, everything, tries to help the body by giving it something foreign, something the body has to try to figure out how to use. Not so with ASEA. The molecules in ASEA are native to the body. See, your body already knows how to take care of itself. Your cells actually make the tools they need, and for the first time in history, you can replenish and reinforce those tools. You can, in fact, give your body more of the native molecules it needs to take care of its own health. ASEA is more than a mere supplement. It is a foundational approach to health and wellness, a fundamental shift in how we take care of ourselves. So are you wondering just what ASEA can do for you? There's one powerful way to find out. Talk to the person who shared this message with you. Get your hands on a case of ASEA and feel for yourself the effects of the world's first and only redox signaling supplement. Your life and your approach to your own health will never be the same.
Thank you, Sansan. Thank you very much. And let me just introduce our speaker. Our speaker for tonight is none other than our Dr. T. Moses, an orthopedic and trauma surgeon in private practice in Kuala Lumpur. Now, every session of his, we learn new things, new knowledge, and I suggest we take notes on the valuable information he's going to share with us. And of course, I want to make a disclaimer that tonight's session is for educational and information only. It is not intended for the diagnosis or treatment or any other sickness, illness, or diseases. See your qualified, licensed professional doctor for all those that you need. So with that, I want to say, Dr. Moses, thank you for taking your time from your busy schedule to be with us tonight. And let's welcome Dr. Moses. Over to you, Dr. Moses.
Yeah. Thank you, Brother Aaron, and good evening, everybody. It's been a short break that we have not met each other. We are back again. Right. I'm not here to tell you that I know everything about ASIA. Neither am I here to to diagnose, treat, or heal. And ASIA does not claim to diagnose, treat, or heal any condition. But we are here to talk about the value of the product. You will only know the value of the product until and unless you use it. If you do not use the product, you will never know the value. Somebody can keep on telling you about how good the product is, but it's nothing like wearing the pair of shoes and running it, and then you realize what the shoe does to you and how it can improve your speed, your agility, the ability to jump, hop, and things like that. So it's basically every one of us have to experience before we can talk about what it does. The good thing about the best thing maybe about this product is there is no such thing as a toxic level. So there's no such thing as you can reach a time when you have drank too much of this particular product. So if you drink, let's say even one bottle per day, I don't think very many people do that. There are some people who are drinking one bottle per day. Even if you drink one bottle per day, you will not have a toxic effect out of this particular product, ASIA. So you cannot have a toxic effect. Now, because you cannot have a toxic effect, while what is commonly called LD50 or lethal dose 50, because you do not have a lethal dose 50, it will never be classified as a particular drug or a medication. You cannot be classified as a medication because there is no such thing as a side effect because of too much of usage. Even Panadol, if you use too much of it, there is a certain toxic effect, and therefore it can be classified as a medication. Whereas ASIA cannot be classified as a medication because it doesn't have an LD50. Why doesn't it have an LD50? Or why doesn't it have a lethal dose? Why doesn't it have a toxic dose? Because like this slide that you watched just now, it is part of our own body system. It belongs to the body naturally. Naturally, they exist in the body. Therefore, whatever ASIA does is basically what the body has been able to do all this while. And now, for some reason, the body is unable to do what it was able to do before. One of the commonest reasons why that happens is because it's an aging process. When you're younger, you are able to heal yourself much better. When you're older, you're not able to heal yourself very much as well. And obviously, there are other effects that comes along the way, not just simply aging process. What we say that the cells have been damaged by a certain process, something that has happened to the cells, something called inflammation. An inflammatory process has happened, and therefore this has caused damage to the cells. And because the damage has happened, it has caused a problem to the system. It has caused a problem to the body itself. So there is a damage that happens to the cell. That cell needs to be repaired. Now, the repair mechanism was excellent when you have excess or when you have good amount of redox molecules. When you do not have good amount of redox molecules, your body is unable to repair itself. So what ASIA does is it supplements you with the redox molecules. All ASIA does is it supplements our body with redox molecules. Because it supplements our body with redox molecules, our body is able to signal the cells that need to be repaired. The cells that need to be repaired are signaled by these molecules. That's why it is called a redox signaling molecule. So this particular molecules or this ASIA water or this ASIA system is a signaling system. It signals to our body that a particular area is damaged, a particular area needs to be repaired, a particular area is not healthy, and therefore it needs to be repaired. So what does it do to a general system? So what does it do to us? How do you see the effects of this? Where do I use them to see any effects at all? Do I use it on a regular basis? Yes, I do it on a regular basis. Some of the patients that I can share with you is what I can help you along the way to understand how this has made a difference. There was this lady who came around. She's about 65 years of age. 10 years ago, she had a surgery to her vocal cords because of swelling, number of swellings in a vocal cord. Because she had swellings in the vocal cord, her voice was affected. She could speak, there was still some voice, but her voice was very soft, or her voice was not clear. So she went to a number of doctors to address this issue, and everyone was not willing to operate on her, saying that she might completely lose the voice if you try to remove this particular swelling in the throat. This was 10 years ago. Anyway, finally, she met up with one particular surgeon who said, okay, we will go ahead with it and remove them, because if we do not remove them, it will cause an obstruction, so it needs to be removed. So they went ahead to remove them. So this particular swelling was removed. She did not lose her voice completely, but her voice became, you have a guitar string. A guitar has got 6 strings. If you strike the first one, the very thin string, you get a kind of a ting sound. So that's what her voice was like when I met her about 5 months ago. Why did I meet her for voice? I didn't meet her for the voice. I met her because she came to me because after her fall, and she had broken a foot. And she came to me and said, I've broken my foot and I've got some pain. I can't walk. So I looked at her and said, that is the simplest of the problems. You don't require surgery. The moment I said she doesn't require surgery, she was very happy to stay with me. So I said, we'll just give you a cast. You should be fine. You should be quite well with a simple procedure. You don't need anything more than that. But I said, I'm more excited about your throat, that, you can't speak very well. She said, this has been going on for more than 10 years now since the surgery. So I said, maybe you can try something that I have, both for your feet as well as your neck. Obviously, she was not very happy to try Redox molecules or Redox, Reno 28. So I told her, I said, you've got nothing to lose. You already spent 10 years with this voice. There's nothing to lose at all. And your foot has got 3 fractures in 3 of your, what we call metatarsals, the bone that connects the toe to the foot. That particular bones were broken. I said, we don't really have a system I don't believe calcium makes any difference to bone healing. And therefore I said, why don't you rub the gel on the foot, it will heal your bones. And at the same time, while you still have a little bit of gel on your hands, rub it on your throat as well and see what happens to your throat. So this lady has been on my follow-up for the last 6 months now, 5+ months. Mind you, she's 64 years, and this is 6 months. She's already been introduced to us before I introduced this to her. Somebody else, she doesn't tell me who introduced it to her. Somebody else is introduced to her and been giving her this Reno 28. She finds drinking ASEA is too expensive for her. These are the 2 categories of patients I have. Those who don't want to take ASEA. The 2 categories of patients that I have are those who say it is too expensive. That is one category. The second category is those who expect results very quickly. I had a lady who came to me. She is like 78 years old. She was dragging her feet and walking with a walking frame. It's called a foot drop. That means, the foot cannot come up because one of the nerves has been affected. So I told her, this has been going on for more than 6 months for you. I cannot turn around things very fast. We don't have any particular system to change, nerve cells. So I told her, take Redox and water and the gel, rub onto the nerve area, which is somewhere near the knee. She came back to me after 2 weeks and said, it's very expensive. It's not changing at all. 2 weeks already, nothing has happened to my feet. I say, nothing will happen in 2 weeks. Obviously, she got very disappointed with me and she left me and I never saw her. So those are the kind of patients that I lose some and I have some. So this lady stuck with me for 5 months. The other lady stayed with me for 2 weeks. 2 weeks, nothing happened. We lost her. This lady stayed for 5 months. Lo and behold, she came last week for her 5th month appointment. We did an X-ray. The 2nd and the 4th bone has already united at about 3 months. Now 5 months, the 3rd one was not healed yet. So when we did the X-ray last week, the 3rd one has also healed. So 2, 3, and 4 have healed. Fine. Bones have healed 5 months at 65 years of age. 3 bones broken in the foot, they have healed just by rubbing Reno 28. I didn't give her any other medication, it's just Reno 28 alone. And then the most interesting thing is what she has been doing with the throat. She has been applying, and she said very diligently applying. She says she's hoping that something will change the voice. This time she came, she can actually speak very well. It doesn't sound like the first string anymore, really. It sounds like maybe the 4th, 3rd, 2nd, and the first string. So she's got a pretty good voice. She's got a good volume. She doesn't sound like as though she's speaking with a voice that's going to break any time now. So it improves. Nerve cells improve. The nerves that were damaged, part of the swelling, part of the infection, part of the surgery that was been there, even for 10 months, 5 months down the road, she's had about, let's say, about 75% of improvement. I'll be seeing her only 6 months later because I don't see patients too often. Patients who are improving, patients already on medication. I have nothing else for me better to do. I tell them, I say, you carry on with it. Whatever you're doing, I'm not going to change anything. I'll see her 6 months later, probably in another 3 sessions. And every 2 months, I hope to meet all of you. Maybe in another 3 sessions, I will tell her probably bring her in to talk to you about what has changed as far as the voice is concerned. So things does happen. If you are skeptical about the value of ASEAN, it works. If you're not sure whether it is functional or not, definitely it works, but it requires time, it requires patience. 3 months ago, this is like end of April, I met one of my very good friends. They run a home in, I shall not tell you too many details, then you might find out who this person is. So these people obviously exist, therefore I don't want to give you names. And he called me on the phone. I speak to him something like once in 3 months, once in twice, 2 months. He had been complaining to me, my wife is losing a memory. My wife is losing a memory. The worst part about somebody losing a memory, a spouse losing a memory, is they begin to suspect the spouse that they are not around. They're not telling them what they are doing. In medicine, it's called paranoia. That means you are kind of suspecting your spouse is doing something behind your back, and that worries. It puts a strain on the relationship. So the husband is a good friend of mine. Both of them are husband and wife. Both of them are good friends of mine. And he said, I really got nothing to do. I said, obviously, the diagnosis is, something to do with, I don't want to give you the diagnosis, in something to do with the brains, it's degenerating. The memory is getting lost. You probably have to go and Google and find out, for yourself, what does this mean? When the brain cells are not really functioning very well, a person is 60 plus years, not really functioning very well, can't remember, forgetting things, place this, something, and then forget it, husband would have said, I'm going out, forgot that husband has gone out somewhere, come back, where did you go? What did you know? Why didn't you tell me? That kind of thing is going on and on and on. And I told him, I said, hey, we all in this profession, but we really got no answer for this. I really got no answer for this. So I said, besides offering you ASEA, I've really got no answer. So they said, okay, we will try, because there's, you're pushed to a corner, you got nothing to lose, So not to say nothing to lose. You've got money to lose, obviously. It costs you about, that's one of the things that you want to ask. I said, it will cost you something like, 1 bottle every 5 days, 2 cups twice a day, 4 cups in a day. So they said, okay, put aromat mats and whatever else, and then, come up to a conclusion. So I told them, I said, I can't really assess you. You have to assess yourself. But I will need to, because I saw them when I introduced the product to them. I said, there are lots of pigments on the feet. I said, why don't you try this Reno on your toes? Because that's the thing that you can really see for yourself. Take some photographs for yourself, watch it change and see what happens. Now, 3 months down the road. So I speak to them once a month. 3 months down the road, I was talking to them. I don't ask them specific questions, obviously, because they're my friends. I don't ask them very detailed questions. I don't go into their family, but I kind of know how to beat around the bush and try and find out what is going on. Because the first time when I talk to them as individuals separately, the first thing the husband will raise up is, hey, she's becoming very suspicious of me. She's not listening to me. She's always, asking me questions. She's always asking the same thing again and again. She's forgetting things. This time when I talked to him about, hey, how's your wife doing? What's happening? What are you guys doing? Nothing like that came out. No, he never complained about, hey, she's forgetting this or she's forgetting that. But then I don't think things are changing. I don't see any great effects. Wait, are you going to continue? Yeah, I'm not going to stop this. I think, yeah. So people are unable to really appreciate the difference because these are all soft points, soft end points. So I have to draw it out of them and find that, so at the end of the day, after talking to both of them together, talking to them separately, and then putting it back to him and saying, hey, you really complain about this. Now you're not really complaining about it. Yeah, actually, thank you very much. I think that the particular product is doing a lot of good, but they have not really gone to the optimal. I told them at least go to two cups twice a day, but they've only gone to 2 cups once a day. And but been very religious with the application of the gel onto the toes that were pretty black toenails. I mean, not toes, toenails that were pretty black. It's very, very difficult to treat this. The pigments have fallen off completely, almost completely. The toenails have become white. So definitely it is working. Something is working. I do not know how long it takes, how much it will take for you. Most of the patients that I tell them 1 cup twice a day to start with, or those who are very, very cautious about the money they are going to spend. I say 1 cup a day for the first week, 2 weeks. Once you get used to it, most of them will have some amount of, most of them who are not too well, they find it very difficult to drink a lot of water, because when you don't drink enough water, you find that you come up with some red spots on your skin, that really puts them off. They don't want to continue. Therefore, I start small with the older patients. I start them with 1 cup once a day, step it up to one cup twice a day, then step it up to 2 cups twice a day, and try to keep 2 cups twice a day for about at least 3 months, if possible, up to 6 months before we stop them. Can we actually stop them? Some of my patients are always asking me, I'm much better now. Can I stop these medications? Can I stop this? Because it's costing me about $600 per month. So my concern with them is always, what has it removed? So this particular patient that came to me, about 75 years old, lady sitting on a wheelchair, cannot step. Somebody wants to ask something?
No.
Okay. So sitting on a wheelchair, 75 years old, cannot walk, backache, can't even stand to walk. 3 months of treatment elsewhere, come back to me and said, I can't, mother is not really doing anything at all, can't even stand up. It's severe pain, can't eat, can't stand, can't move. So I told her, obviously, I can't change things very fast. I say, let me try something for you. The first thing I do normally is, for older patients, is try and reduce their medication as much as possible. So I am obviously treating them as a doctor as well. Took away a lot of the medications. After that, I told them, I said, why don't you try ASEA? Then they started trying ASEA 1 cup twice. Like I told you, for older people, I started 1 cup once a day. Then after 1 or 2 weeks, 1 cup twice a day. Now she's gone up to 2 cups twice a day, 3 months. When she used to come to me the very first time 3 months ago, she was coming on a wheelchair. I might be speaking a little bit fast for you to catch up. If you cannot, please ask me again later. So she couldn't walk at 3 months ago. She couldn't even stand up. She couldn't even stand, hold my table and stand. 3 months down the road, 2 cups twice a day. They also asked me the same thing, and we start reducing. She's doing much better now. I said, it's not time to reduce now. So at 3 months, she's able to stand on her own without a walking frame, take a few steps, walk within the house, front to back, and up and down within the house, independent walking. Just ASEA taking away a lot of medications that has been prescribed previously. So it's a combination of everything together. So I cannot say that, just this one particular product, but without this particular product, things would not have changed as much as we have seen. So I've told you about 3 people who have actually changed. When do we actually reduce them? Can you actually reduce this ASEA from 2 cups twice a day to less than that? Because 2 cups twice a day will cost you something like about 750 ringgit, even if you buy it yourself, 150 per ringgit per bottle. It will cost you something like about 5 bottles. That's about 750 ringgit per bottle. So how do I convince people to continue taking this for 6 months? I keep telling them, I said, before that, what were you taking? How much medication were you taking? They would have probably spent about 300 to 400 per month on medications alone. So just on medications alone, minus consultations. Now, once you have taken, signed up with me, they don't take a consult. I don't take a consultation from them. So they are only paying 750. That's it per month. So I tell them that you actually not spending much more than what you're spending before this. So it's not really that expensive. So to those who have been using Reno 28, most of them have gone off all their cosmetics. So I said you have actually made it cheaper for you than what it was more expensive for you when you're using all the cosmetics. Because those of them who have tried Reno on their face because of red pigmentations due to whatever it is, red spots that come and go on their faces, especially between the eyebrows, right in the center, especially between the eyebrows. Those who have tried that with all kinds of other medications, but those who have persistent with Reno 28 for 2 months, twice a day for 2 months, I think in the first 2 weeks, the red spots slowly disappear. After that, if they continue using for 2 months, it completely disappears. It doesn't come back, but you can't stop Reno 28. You have to continue using. Now, why can't you stop? Let me finish. I've got 3 or 4 more examples to share with you, but I think I shall not share the 4 examples. Keep it for next time. But let me stop with why you cannot stop Reno 28, why you cannot stop ASEA Redox water from being consumed or from being applied. Like we already heard from the tape, it is not a supplement. So you're not lacking in a particular supplement. Therefore, you use ASEA, you use Reno 28, and then you have supplemented yourself. You have got your maximum supplement, and then you don't need any more for the rest of your life. It is not like that. This is not a supplement. This is a signaling molecule. It goes into your system. It's a highly reactive molecule. It doesn't last forever. It doesn't build up, so you can't build up these molecules and keep it forever in your system. So it goes into your system. It is used in a short while, and then it is no more there. And then you need to replenish again because you don't have these molecules again to signal. Therefore, that's why we tell them to take it. If you are taking 4 cups a day, to those who are able to take, I tell them 1 cup, 1 cup, 1 cup, 1 cup, 4 cups divided into every 3 hours rather than 2 cups divided into, 8 hours apart or 6 hours apart. It's better for you to take, if you're taking 4 cups, every 3 hours, take 1 cup. But it is very difficult to take every 3 hours, 1 cup. So therefore, because these are very reactive molecules and they don't stay in the system for a very long period of time, you cannot stop them completely. If you have come to a stage when things have actually gotten better and you're very stable in your situation, you can start reducing your amount of consumption just to make sure, just to try and conserve some of your expenditure, but you cannot completely go out from it. Let me just stop by saying one last example of two different people, both of them came to me with difficulty to walk. I mean, the name of the disease starts with a P and ends with an N. You please put the other words in between. Both of them, came with a problem, medicated for about 3, 4 years, 5 years, and then not getting better. One person decided to try. The other person said, it's too expensive, and I don't think so. It really works. I don't think so. It's really doing, much of a good. I am not convinced with it. I couldn't convince him. I said, fine, thank you very much. I said, one person took it, the other person didn't take it. Now, 1 year down the road, the person who took it is much better, still carrying on with his occupation. The person who didn't take it is now housebound. So it makes a difference. So we really don't have a large enough study. So I don't have, let's say, 100 people with a particular condition, 50 of them tried it and 50 of them didn't try it and then make a difference. If you have that kind of a volume, yes, you can try. But I only have 2 people with the same illness. One tried, one didn't try. And the one who tried it is up and about and walking, not completely well, but much, much more easier to walk and be functional in his occupation that he's been doing. The other person can't go to his occupation, can't go to his office, housebound, needs a lot of help. Let me stop. Maybe you can ask me, I need some help from you as well. See what you have been using, what you have been trying, how you've been using this particular product with your own clients. You can share with me. Maybe I can help you a little bit to whatever way I can.
Thank you, doctor, for sharing the success stories. They are indeed very encouraging. We feel very encouraged, and of course, our listeners are doing the same too. It covers on the bone, talks about the voice, memory losses. I like particularly you said you are reducing the intake of medication. Now, this is what that we are actually looking forward, and of course, pigmentation too. So these are certainly very encouraging, and I also wanted to just let our listeners know you can unmute yourself and ask questions to Dr. Moses, and he'll be able to answer. And to those of us who are not able to, they feel shy about it, you can always drop a note in the chat box, and I will be able to bring forth this question. It is good that you can, switch on your video so that we can see you and we are able to interact and talk to you. So with that, I want to say, okay, now you can please unmute yourself and ask such questions as you need and Dr. Moses will be able to answer. Thank you.
Hi, Dr. Moses. I have one question to ask. I have a client that he has been on Asia for about 2-3 weeks. So 1 cup in the morning and 1 cup in the evening. So
the line was bad, Wilson. The line is distortion. Can't hear you. Cannot hear you, Wilson.
You can switch off your video, Wilson. It will be a little bit better. Yeah.
Yeah, switch off.
Switch off your video and you continue with your question.
All right. So, okay, did you hear me? Okay.
Sure, sure.
All right. So he's just wondering, should he start reducing his hypertension medication? He's on Tolura, I think Tolura 80 mg per day, which is 1 tab. Yeah.
Yeah, like I said, I will not be able to give you such a consultation saying that you can take off a certain medication. But definitely, if you're on ASIA only for 1 or 2 weeks, it's still very early. 1 cup twice a day is still very early. I think let's carry on little while longer with with ASIA for, let's say, for 2 months. Regularly monitor your blood pressure, keep a record of it, go back and show your doctor what the readings are on a daily basis or on a weekly basis. Once your doctor, who you regularly consult, is able to see the spectrum of the blood pressure, then he can decide for you whether you can actually reduce your medication or not. I will not be able to tell you to reduce the medication straight away like this.
Okay, yeah, because past few days he has been going like 100 over 65, 66. So he's a bit worried that he's feel a bit giddy.
Yeah. Yeah, it's good to drop by the doctor and see whether he can suggest something to reduce your medication.
All right.
Most of them, because most of them will say ASIA is not good for high blood pressure because there's salt in it. Salt water and salt is not very good for high blood pressure. Do not worry. Do not worry about, So when you go to your doctor who doesn't know about ASIA, who doesn't feel that ASIA will do you good for high blood pressure, do not have to introduce to it. Just tell them, I'm taking some supplements and, along the way, my blood pressure is coming down. Can I actually reduce my medication?
All right, noted. But my mom, by the way, she's 7 months off her hypertension medication.
Great. Great.
Yeah. All right. Thanks, Dr. Moses.
How much ASIA is she taking?
My mom, she's on 2 cups, 2 in the morning, 2 in the evening, 4 cups a day.
Great. So she's doing well. Wonderful. Nice to hear.
Thanks, doctor.
That's another success story like that. If you can share with us your success story, your own mother who's been, on high blood pressure pills, taken 6 months, 7 months of Redox and now off medication. That's very good. Excellent.
Yeah. Thank you, sir. Thanks, doctor. All right. I'm glad. Thank you.
Let's have another question. You can always, drop a note in the chat box and I can also get the question up to Dr. Moses.
My question on the chat box, can you read about the rope cell of the brain?
Yeah. This is many months ago, Dr. Moses, you shared. These are rope cells in the brain. And let me take a look and see. All right, okay. Dr. Moses, you recall the last session with you, you said you have a brain patient, has rope cells. He was taking a Redox. How is he now? It's almost 6 weeks, more than 6 weeks now.
It's already 3 months now. It's already 3 months.
Or 3 months.
After the first 2 months of taking the ASIA, he has been the same. He's not changed in the sense that, he's able to walk, but he's not really independent. But what happened was he was not able to, like I said, older patients are unable to take a lot of water. So he developed a lot of red rashes, all over the body. And the family felt that, he's unable to consume the ASIA because of these cells. I told them those are the side effects of cells, but then they were not happy to carry on with ASIA. So I've stopped the ASIA for them. Patients were still around, but they are applying the Renu because he developed mouth ulcers as well, which is a common thing that happens when patients are compromised in their immune strength. He developed mouth ulcers, which was not responding to anything. So I started using Renu 28 for mouth ulcers, and that has settled down. But as far as the rogue cells in the brain is concerned, it is not expanding, but it's not improving.
Thank you. Yeah, thank you.
Yeah, maybe San can share about her mother here. So let Dr. Moses hear your testimony of your mom. Just came back yesterday from KL hospital after the brain tumor examination. San, can you hear?
Oh, yes.
Yeah, share your story. Your story is amazing. And how she stopped taking steroid, everything. Yeah, maybe from your horse mouth. Come share.
Okay. My mom actually started to be losing her ability in walking and basically taking care of herself since middle of April. And then we take her to KL Summer Medical Center to check what's actually happening, because previously she had this brain tumor removal surgery back to 2018. And then after the surgery, she had radiation therapy for more than 10 sessions. And so yes, it's just within 3 years. And now last month, when we was in the Summer Medical Center, doctor actually diagnosed my mom to be having the radiation necrosis. So doctor prescribed the steroid for my mom when she was hospitalized, and basically around 10 days, about 10 days, she was having depression. But actually starting since when? Starting of May, she's consuming this ASEA, but the dose is quite low. It's like 2 cups per day, and then add on to increasing to 6 cups per day. And when we were hospitalized, I actually let her to drink a bottle a day. It's just that because of the steroid, she also had this side effect of depression. So because of the depression, she threw away all her medication, including the steroid. So basically, she only take the steroid for 10 days. And after that, but I didn't stop her in taking the ASEA. I still keep on give her the ASEA at least a bottle a day, or if really something happened, then maybe just half a bottle a day, but we still continue every day for that. And after she stopped the steroid medication, she's suffering depression. And then after a week, her depression gone. She back to, she gained back her conscious. And then slowly, she's also improving in her physical. So she started to be able to walk, but of course with assistance. And then, yeah, and then we went back to the doctor. Doctor said if she stopped the medication of steroid and her physical is improving, and then her mental health is also improving, then might as well just stop the steroid for that. And my mom has a very stubborn character, so she said she insists to have another MRI scan just within a month. So doctor actually advised that the MRI scan actually will not show anything different. But she insists, so he let her. And then the MRI scan eventually showed that the brain swollen actually reduced. So the doctor saw that himself, so he said, my mom is good to go back home for now, because radiation necrosis, honestly, I'm not so sure what's the actually is the best treatment for that, but doctor said as long as the brain swollen reduce, the inflammation reduce, it does not affect her physical movement, then she will be fine actually. So I'm actually just continue to give her the ASEA bottle a day until now. Now we're back to Tawau. We are quarantined, and yeah, basically her movement, her physical is improving. She can shower by herself. She's happy even though she's quite boring here right now. So that's the improvement I see in her.
Thank you. Excellent sharing. What do you think, Dr. Moses? Great, right?
Yeah, I mean, this is side effects of radiation. So like we have already mentioned, nerve cells have a potential to regenerate or recover. And sometimes mother has actually experienced that amount of recovery in a shorter period of time, which is excellent, which is really, really very, very good. So, I mean, all I can say is ASEA works. So she has been using a very high dose. Again, we said that there's no such thing as LD50. That means you cannot become toxic because of ASEA. Therefore, even taking 1 bottle per day, as far as Sansan's mother is concerned, hasn't caused any great side effects. You know, she's not had, I suppose she's drinking a lot of water as well. So which is very, very good. So the testimony is excellent. That in fact, it's been documented by evidence that MRI shows that the inflammation has actually shrunk. So it's a very good testimony. Great.
Thank you.
Just that
Thank you.
I have a concern is that she's having this consistent rashes all the time. So
Rashes is part of
that's the detox, right?
It's a part of detox. Drink a lot of water.
Okay, all right. Okay, thank you.
Okay, thank you. Dr. Moses, what are your thoughts on pregnant women? They want to have supplements and they want to take a Redox supplement to be. What are your thoughts on that? They don't have any medical condition whatsoever.
Yeah, I mean, we are always told to be very cautious about pregnant women, mainly because there is a baby that is being formed in the womb, and therefore we don't want anything to go wrong, and we don't want anybody to turn around and blame us for what can possibly happen to the child, and therefore none of us will be able to say for sure, yes, you can go ahead, take ASIA and you will have no problems, because there are no documented evidences of this being used in pregnant ladies during their pregnancies. Therefore, we have got no evidence to say that yes, you can go ahead and use it. But we know for sure that even if you use it, it cannot cause any harm, right? Because it is, we said right from the very beginning, it is native to our system. We also say there's no LD50. That means there's no lethal dose. You cannot take enough, to cause trouble for yourself. But in a growing fetus where there are, organs that are being formed, there are changes that are happening at the genetic levels, can ASIA make a difference? We really do not know whether it can cause problems. So we don't want to use it and say, take this as a supplement during pregnancy, because things can go wrong by itself. It might not be attributed to ASIA, and then people will say, oh, because I took it, this happened. Therefore, we don't want to be in that position. And therefore, we do not advocate this for the use during pregnancy.
Thank you, doctor.
There's a question in the chat. A question in the chat.
Okay, I have a question for doctor. Is there anyone who has a specific allergy or condition that is not advisable to take this supplement?
The simplest answer is no. No such thing as an allergic condition that you cannot take ASIA. Like we have already mentioned it, I think in the passing, even in Sansan's mother, she said that she's got this red spots in the body because of taking ASIA. That is not an allergy. That is the word that she used is what we call. What did he use, Sansan? The word that he used?
Detox.
Detox. Yeah, you can call it detox. You can call it
healing crisis.
Healing crisis.
I would want to say, it's coming out through your sweat glands rather than coming out in your urine. Your toxin is coming out through your sweat glands. So every sweat gland in your skin will show up because the toxin is being excreted. If it is excreted in the urine, it goes out in the urine. You don't see anything at all because you have flushed it out in the water and you don't see anything. Now, when you don't drink enough water and it doesn't go out in your urine, the body is forced to send it out somewhere else. And one of the best forms to send it out is through the sweat. And when it comes out through the sweat glands, you will have the sweat glands being enhanced or shown to you as, hey, these are the areas where your sweat glands are. So these are the red spots around your sweat glands, and they are very temporary. So you can call it healing crisis, you can call it, anything else that you want to call it, but it is a toxin that is coming up through your sweat glands. So it will happen. So if you have an allergic condition, that is the only problem. If you take, ASIA, then you have red spots further, then they think, oh, this is causing more allergy. It is not causing more allergy, but it is causing a detox situation. Drink a lot more water. So there's the simplest answer to anybody who says, can I take ASIA for an allergic condition? Obviously, you can take. Will it cause further allergy? It will not cause further allergy. Can I see a turnaround in the symptoms? Yes, you can see a turnaround in symptoms. But more important than all, try and identify what is causing your allergy, if you can at all. If you can identify the allergy, what is causing the allergy, then remove the allergen. That will be very good. one of the commonest cause of allergy today, besides pets, besides fur, is aroma. That means any kind of perfume, anything that comes in the air, anything, that you put in your car for perfume that you apply, a change of perfume or change of cologne, whatever it is, one of those kind of fragrance, even detergent fragrance can cause an allergic reaction. So try and identify the allergic reaction. Use ASEA, use Renu, it'll be great.
Okay, thank you. Another question from our listeners? While waiting for them to come up with a question, Doctor, what about as a preventive measure? Now, seniors, like many of us, most common, you have knee problems. You have knee problems over a period of time. And let's say they're above 60 and they don't have a problem now, but probably by applying it now in advance, is it going to have an impact in 5-10 years to come? It will reduce the cases or the pain or whatever it is?
Yeah, okay, fine. So thanks, Brother Aaron. This is something that I thought I will talk about earlier on. I thought I'll cut short in case somebody asked the question. Prevention is better than cure. That is the mantra of medicine all the while, right? You want to prevent something rather than cure it when it comes, or address it when it comes. So if you can address it before it comes, the problem of addressing it before it comes is how costly it's going to be. How costly is it going to be? Are you going to convince that person, hey, you use this and therefore you don't end up with this problem? We've got no idea something like that can happen. But from first principles, that means, what does ASEA do? ASEA is basically your own molecules. This was first found in 1998. The nitric oxide was the first redox molecule that was found. So it has been found for a very long period of time. It has been with us for a long period of time. So what it does is basically repairs our damaged cells, or our unhealthy cells are being repaired. So these are cells that can cause damage later on in life, whether it is in the joint in the form of cartilage that can cause arthritis, whether it is in the form of in the vessels that can cause a block and cause, whether it's, whichever organ that is involved with the heart, your brain or liver, those areas that are blocked, if the blood vessel gets blocked, those areas get damaged. So to prevent those damages from coming around by blocking the artery or by damaging the cartilage, we know that these cells can be revived and repaired before they get damaged. And how do you repair them? You repair them by using antioxidants. And who brings about these antioxidants? Redox signaling molecules. Redox signaling molecules we know will enhance antioxidants in our system up to 500%. We know that for sure. And therefore, if you use them, it will work as a preventative measure. But can we convince people to use them? Depending on how much they have in their hands to expend for themselves. If it's one Renu, to patients who want to use them like that, I tell them you can use one Renu for 1 month. Because once you open your Renu, you can't keep it for longer than 1 month. So you use it once 1 month. So how to use for 1 month? You apply twice a day for 5 or 6 days per week. You probably forget your weekend. You will use one Renu for 1 month. So if you can use a Renu for 1 month, 1 knee, 2 knees, I think you can use it for 2 knees for 1 month. Or if you are using ASEA Redox, if you are taking 1 cup twice a day, you probably will use one bottle over 8 days, 3 bottles per month. So that's roughly what they can use as a preventative measure. Both in terms of cost, it's like 150 times 3, 150 times 4, including 1 Renu, that's like 600 per month. Definitely useful as a preventative measure.
Yeah, thank you. Thank you. Okay, we have time for one last question.
Yes, one last question I ask.
Yeah.
Dr. Moses, we have a customer whereby sometimes listening to us being non-medical profession, right? And they like to consult you because they're from East Malaysia, so not be able to in KL see you, right? If we consult you by Zoom Live, is it possible they'll pay for, whatever that you charge? Is it possible to consult you to get your opinion directly? Sometimes their personal question would like to ask you instead of from us.
Yeah, Bule, but try and keep it during clinic hours, lah.
Non-clinic, during clinic hour or non-clinic hour?
Clinic hours. Non-clinic hours very susah. I want have my own time, like so. Like this one is casual non-clinic hours. So clinic hours are basically it's in my web page as well on Wednesday, Friday, or Saturday mornings. You can tell me ahead of time what time you're coming on the Zoom, and then I can talk to you for a short while. No problem.
Okay, great. Thank you.
Yeah, thank you. So there are 3 days a week, right, Doc?
Yeah. Wednesday, Fridays, and Saturday mornings. Only mornings.
Okay.
Only morning available, huh? Okay.
Okay.
Great.
Thank you, Doc. Thank you for your time. Really, we appreciate your sharing with us, and really, we are looking forward for the next session. And I want to thank those of us who are present. If you need any questions that you need to answer or you need to get it answered, please communicate with those people who have introduced you so that your queries can be attended to. So with that, we want to say thank you again, and you can unmute yourself and say hello and thank you and goodbye to Dr. Moses at this time.
Thank you, Dr. Moses. Cheers.
Good night. Cheers.
Excellent. Good night. Thank you.
Thank you.
Very good session. We really appreciate it. Fantastic. Yeah, thank you.